If you're a driven, active person who wants to reach and pursue a higher quality life with some ambition, then guess what? This podcast is for you. This is the Driven Athlete Podcast. What's up, y'all? It's me and Dr. Kyle. Welcome back to the Driven Athlete Podcast, where we try to talk about everything health, wellness, fitness, orthopedic, sports, longevity, health, which is why we got our special guest, Kyle Hulbert, here with us with a longevity center here in West Palm Beach and South Carolina, right?
Yep.
But yeah, I know you're a busy guy, so I appreciate you, coming in and sharing insights on all things longevity.
Yeah. No, I'm glad to be here. It's always a great opportunity to share kind of what's going on in longevity medicine, some of the advances, some of the things we're working on. So.
Yeah, no, it's super interesting. And you just got back from overseas in Paris?
Yeah. It was actually the south of France. It was Cannes or Cannes, or I don't know how to say it, but yeah, it was really cool. There's a women's health documentary that we're friends with the producers, and they invited us out to the premiere.
Cool.
They were in the USA Film Pavilion at the film festival there. And it was a really cool opportunity because we got to meet some of the the biggest names in biohacking and longevity medicine, and a lot of cool biological dentists and people in the stem cell space, people in the peptide space.
Interesting. Like who?
Like we met Jay Campbell. I'm not sure if you know Jay Campbell, but he's like number one in the peptide space. He's like the peptide guru. We met another guy named Bruce. He's big in the stem cell space. One of the OG guys in stem cells, and then just a lot of different other people.
And they primarily work in America? Do they?
Yeah. It was a bunch of U.S. based people. There were a few people from like Costa Rica, in Central America that are doing like medical tourism. So they serve generally Americans who fly in.
Yeah, interesting. So this guy Bruce, he's the pioneer for stem cell stuff.
Mm-hmm.
Was he some of the beginning introductions for yourself and you guys?
Yeah, so we met him there in Cannes not too long ago. But he created a product that was like, he was like the OG creator of one of the products that we use for joint injections. Since then, it's like 3 generations past the product we use. But he's been doing this for decades, and he understands it to a level that very few people do.
That's cool. That's awesome. So tell people the Longevity Center, right? The Longevity Center. You and Dr. Ben Kosubevsky, right?
Yeah, Dr. K.
Dr. K. Y'all are in West Palm Beach, right here, right? Right off Village.
So we got a location here in West Palm Beach, right off Village Boulevard. We have a location at Hippocrates Health Institute.
Yeah.
Now as well.
I'm familiar.
Yep.
How'd y'all link up there?
Honestly, it was just kind of, I think we had a patient in common.
Mutual patient.
And he was like, they need support on the medical side with the IVs and stuff. And we were like, well, we do that.
Yeah.
And we just started talking.
Cool.
So we started in May there, and so this will be our second month. It's really cool.
Amazing.
It's really cool to be, because when you have an outpatient office where you come and get therapies, IVs, and stuff like that, treatments, you don't necessarily have good compliance with the diet and lifestyle aspects. But when people are at Hippocrates, there's no choice.
Yeah.
You're there. You're eating the clean diet. You're doing all of the lifestyle things. You're doing the workouts. You're doing everything.
Yeah.
And so it's pretty cool because it's like this little insulated environment where you can enact massive amounts of health change in 3 to 4 weeks.
Yeah. That's cool. Just full immersion.
Mm-hmm.
I visited them and met the owner a couple of years ago.
Brian.
It's a cool spot. Like it's very interesting. It was cool, that's awesome. So you guys, so tell the people like what do you guys do, right? Somebody calls and said like, I want to help my health and wellness. What do you guys do? What would you answer?
Yeah, we do literally everything in integrative medicine. So if it exists in functional integrative medicine, we do it. Anywhere from, detox for heavy metals, chelation, EBU, which is a blood, filtration technology, all the way to regenerative injections with stem cells and grafts. We do some aesthetics, some like all natural aesthetics. Really, if it does exist, we do it. We even do optimization. We do peptides. So, if like you look at your lab work and everything's in range, we can still say, hey, these are the 4 things that are in range, but they're not optimal. Let's get you dialed in.
Bump that up.
Yeah, we can do actual longevity medicine where we're focusing on life extension, health span extension.
Yeah.
Primarily, the majority of our patients are focused on some complex chronic thing that they have.
Like chronic Lyme disease.
Yeah, Lyme, Epstein-Barr, heavy metals, mystery illness. That's one we get all the time. I'm sick. I don't know why. I've been to 7, 8, 12 doctors. They can't figure it out. Can you help me? Like, that's our jam.
What are they? Okay, good. That's good to know. What would you usually find with those people?
We usually find like one of 5 things that usually pop up is heavy metals, mold, Epstein-Barr, viral reactivation, Lyme disease, parasites. It's the things that most doctors don't look for.
Yeah. Mold and heavy metals. Would it be a combination of all of them?
It can be.
Like you have elevated mold that you're harboring, and they would, and they're where? And like there's interstitial tissues in their joints and their brain. Like
it's usually a mix. So it depends on what it is. So like heavy metals, for example, love tissues and organs. So like each heavy metal has a target organ.
Okay.
Example, lead loves the bones. So you can actually test a woman's lead levels across her menstrual cycle, and the levels of lead will change because of the bone mineral connection with the cycle.
Interesting.
Yep. So
wow.
like mercury loves the brain, and then each kind of toxin has a specific place where it likes to live.
Wow. So how do you guys diagnose that?
We have a variety of tests. We start with comprehensive lab work though.
Okay.
So we try to take an affordable approach. You come in, consult, it's $175. That $175 gets applied to your first treatment. So the consult's technically free. From there, we do comprehensive blood work. So you leave with a script. It's kind of like function labs, except it's a few more biomarkers. We're looking for deep things. And then when we get that back, we do what we call a lab review, where we go over all your blood work. And then from there, doc or one of our practitioners will recommend, hey, I think you need this specialty test. Maybe we need to test for mold. Maybe we need to test for heavy metals or Lyme. Based on these results and what you've told me on your subjective symptoms and goals, this is where we need to go.
Cool.
Yeah. So we take it one at a time. That's how our approach differs from a lot of like integrative medicine and functional medicine doctors, because a big part of functional integrative medicine is the diagnostics. And so you come in $5,000 and we're going to test you for everything, which makes the doctor's job really easy.
Yeah.
Right. Like I have all this data, like I know what to do. But the flip side is the patient didn't get anything from that in terms of actual health improvement.
Right. There's no actual intervention that happened, just testing.
Yep. So basically we run after our overhead, we run all of our consults and our lab testing all at a loss to get the patient to a plan where they can get treatment and feel better.
Yeah. I think it's interesting is like, at least from our end, something I've asked a lot, where it's like someone that goes to a facility or a place, if it's an orthopedic, musculoskeletal issue or internal medicine kind of approach. I'm like, what did they actually do to solve your problem? And like really common one with that is like vestibular vertigo dysfunction. There's just like test after test after consult. And they're like, I'm seeing this ENT doc, or I'm seeing this other, ophthalmologist or something like that. And I'm like, what exactly have you done though to intervene to help the problem? Nothing. Like literally nothing. They're just waiting for another test. And that happens so often, So musculoskeletal is very similar to a consult with a doc or like imaging and stuff like that. I'm like, so far you mentioned that it's been bothering you for 3 months, right? You started pursuing this, 6 weeks ago. In this 6 weeks, you've done nothing.
Literally nothing.
Literally nothing has like, you haven't taken a step forward in any action plan. Where I'm like, dude, let me evaluate you at least, and we'll treat you day one, and we can at least get you on a track. It's just a bummer.
Well, and the beauty about doing the comprehensive lab work first and then the specialty tests is 90% of the time we'll find some low-lying fruit, right? Your vitamin D's low, or your testosterone's low, or something really easy to fix. Yeah. And then out the gate, they're feeling better. Yeah. It's probably not the solve, it's probably not the root, but
at least some things are
we're feeling better.
Yeah. We're on the track. Some steps have been taken. All right. So you said your wheelhouse is the mystery illness. I'm sick. I don't know why. chronic undiagnosed issues that Western allopathic medicine can't find otherwise.
Yep.
And then it's like, now that we have this information, now we know we can actually take steps forward to treat it. And that would include like blood detox stuff, which would be like EBU.
Yep.
And does that, so like somebody comes in with heavy metals, you tested it, you found abnormalities. Like we think it's this mold, heavy metals, some kind of parasite issue, Epstein-Barr or Lyme. Those are the most common ones you said. Yeah. How do you, does EBU treat those things? Like, what do you do?
It does in some of them. So EBU is not a front line in heavy metals. We use chelation for that. So it's a specific molecule that binds to the heavy metals in the body, and you excrete them through the kidneys.
And that's an injection or an IV drip?
An IV.
Okay.
Yeah. So based on how many heavy metals, your concentration, your toxicity levels, how many you'd have to do to get rid of them. People often, though, do EBU in between those because chelation is not necessarily fun. Like you get an IV to remove your heavy metals, and you do get an exacerbation of the symptoms that you have from those heavy metals as they're going out. So people will do EBU to kind of clean up the system to reduce those detox effects.
Okay. Explain EBU.
Yeah, EBU is extracorporeal blood oxygenation and ozonation. That's why people call it EBU.
Yeah. Like, do you guys have that extracorporeal bit?
I don't think I've ever heard a patient say the full name. Not once.
Extracorporeal blood oxygenation and ozonation.
Yep.
Okay.
So basically, it's a closed loop system. Pull blood out of one arm, run it through a dialysis filter, which gets mixed with ozone and oxygen. It runs through a UV light system and then back into the other arm. So it's kind of like they say it's like an oil change for the blood.
Yeah.
But basically, what it does is the filter filters out debris, dead bacteria, and things like that. The ozone kills bacteria, modulates the immune system, kills viruses, also super oxygenates the body. And oxygen is kind of the
lifeblood. Yeah, no pun intended.
Literally, quite literally. And then it goes through the UV system. The UV system further kills those negative things. It'll also pull out toxins in that filter. So like the biggest one we see is glyphosate. Like massive amounts of glyphosate coming out.
What's glyphosate?
Roundup. Glyphosate is basically a pesticide that's used in almost all of our food.
Yeah. Wow.
Yeah. And it's a toxin. I mean, if you think about things that are specifically meant to kill bugs, is it going to have zero health effects on us?
I know. Yeah. Right. It's hard to say that.
It's probably not going to kill us like it'll kill a bug, but you keep eating it over and over and over and over again for decades, you're probably going to get some negative effects from it.
Interesting. So understood, glyphosate makes total sense. Pesticides, the foods we eat, all the agriculture. What are heavy metals? How do you harbor that?
Yeah, heavy metals, they come from all over. One of the biggest sources is actually from each person's mother. So they actually transfer in the womb. So a big portion of the burden of the heavy metals that the mother has will transfer to the baby. So most people start out with a baseline of heavy metals, and then through the world we live in, accumulate different types.
Yeah,
so,
through what? Like just the air, like the
air,
food,
water, food, different exposures. So like it's different for every metal. So like mercury, for example, the biggest one is amalgam fillings. So like silver fillings.
Yeah.
And then
I got a couple of those.
Like tuna and large fish consumption. And for some people, it's not a problem. Like some people's bodies, based on their genetics, based on how they detox, they can tag it and they excrete it, and it's really no issue.
I was going to ask, so some people, they just have a genetic predisposition to just harbor and hang on to certain heavy metals more so than others.
Yep.
And then if they do another genetic predisposition to just have it be harbored in their organs, like brain for the mercury, lead in their bones, and then they just will present symptoms.
Yeah. So, and like a great example of this, the most extreme example is like people with Japanese ancestry, right? They have a genetic mutation that actually allows them to tag and excrete mercury in fish, because Japan would have ceased to exist.
Yeah.
With the amount of tuna they eat.
Yeah, right. Super heavy.
Yeah. So they can eat tuna all day and have no health consequences from it. Interesting.
That's super. I mean, it makes total sense. And then parasites. Everybody has parasites.
Everybody has parasites. So like literally everyone rocking around. If you're listening to this podcast,
If you're alive with a pulse.
you actively have parasites. And people don't understand that, right? People freak out when they get parasite test results. They're like, oh my gosh, I have bugs.
I have worms in me.
Yeah, I'm like, okay, everyone has some level of parasites. It's only a problem if it's certain types and then too many, right? So, and you get exposed to them everywhere. I mean, it's in water, it's in food. You go get sushi, like
sushi.
yeah,
Deli meat.
Yeah, it's pork. Pork's a big one.
Interesting. Even if it's cooked like well,
if it's cooked really well, it's safer. But I mean, you still think of like, you know, when I get a pork chop, I don't want that thing well done. It's gonna be like
it's gonna be a rock.
Yeah.
What about ribs? Pulled pork?
Yeah. Mm-hmm. Yeah.
I mean, I'm a pork guy for sure. Like, I mean, I'll eat it all the time, but a good pulled pork sandwich or ribs. Oh my gosh. Yeah. Let's go.
Yeah. So it's better if you cook it. So obviously the less cooked it is, the more at risk for parasites you are. So that's why like sushi is like a big one because it's raw.
So then you would test similar thing, like comprehensive blood work testing that would indicate they have parasites at an elevated level or the ones they don't want.
Yeah, so we do a GI map. It's a specialty test for that. We've actually found that a lot of times, because everyone has parasites, if they're presenting with parasite-based symptoms, we offer them, hey, do you want to do testing or do you just want to do treatment? Testing's going to be like $500-$600 and the treatment is probably similar. You could just do it.
Yeah. Yeah.
And because everyone has some level of parasites, it's almost always beneficial.
What do people feel after parasite removal treatment? Are they like, man, I feel lighter, I feel less bloating? Like, what do they feel?
Yeah, you name it. The GI symptoms are usually the biggest one. So less bloating, more regularity. I feel a little bit more energy because I'm actually absorbing my nutrients better.
Yeah.
But it goes so far as like we had one patient who did a parasite cleanse and she went off of testosterone right before she did the parasite cleanse. And when you're on testosterone and you go off it, you assume that the testosterone levels are going to drop dramatically, right?
Yeah.
And back to her baseline.
Mm-hmm.
And she actually was 2 or 3x her baseline post the parasite
without
cleanse.
the CRT,
because whatever those parasites were doing,
they were absorbing the testosterone too.
They were limiting her testosterone.
That's so interesting. Like, I love that stuff because I'm like, there has to be the way my brain goes. I'm like, there has to be an answer of why somebody just naturally has low levels of something, barring some like genetic issue, which we can't change. And then you would be like, okay, we need supplementation.
Yeah.
Where it's like, you're low in this, let's just supplement with this. I'm like, well, is there a reason why?
Well, and that drives me nuts, right? Because I hear so often doctors and people online and on podcasts are like, root cause, like let's find the root cause of the dysfunction. You need hormonal balancing, hormonal optimization. And I'm like,
that's still a symptom treatment.
That is literally a symptom.
Yeah.
Your hormones don't just decide to take a left.
Yeah.
Like they don't just go off.
Yeah.
There is a reason. If you're attacking the root cause, you're looking for why those hormones are off.
Yeah.
There's nothing wrong with treating the hormones, make them feel better right now.
Yeah.
But while you're doing that, keep looking.
Yeah. And it's so, and what your guys' lens is saying, it's usually one of these 5 things: chronic Epstein-Barr, Lyme issue, parasites excessively or the incorrect ones, mold harboring, and heavy metal harboring.
Yep. So most of our patients will, it's either like a combination of like, it's either one thing that's super high and then not much on anything else, or like medium levels of everything.
Gotcha. The other thing I go with on that, and then other very touchy subjects is like cancer, or genetic issues that people will say. I'm going to say this. Other chronic issues, that terminal problems like multiple sclerosis or even RA. The lens I have with this kind of stuff, whether my head works on this, and you correct me what your thought is too, but somebody already has an underlying genetic predisposition to harbor metals or to have these kind of pathologies present, and then irritation and system inflammation tips the scale for then those genetic predispositions to be expressed and tripped, that then cause problems like multiple sclerosis, RA, cancerous development, where it's like, if you go back, like those, like if somebody just developed multiple sclerosis, they were just born to have it. It's like, I'm not fully convinced. They have a genetic predisposition to develop that MS, but because of an underlying chronic inflammatory, irritated systemic state that tripped that scale, but that was caused because of stuff like this. Is that accurate?
Yeah, I mean, I would 100% agree. So like, if you look at MS, like I know people who get their MS completely under control. Like they had a massive flare up. They realized they got diagnosed. They changed their diet. They changed their lifestyle. They detoxed. They did all the things. And then it's been years and they've had no problems. Right.
Like they're like functionally.
Yeah. They're good.
Will their myelin regenerate?
That's actually a good question.
Because I know central nervous system myelin, if I get this correct, the oligodendrocytes, they don't regenerate. Whereas the Schwann cells, which are the myelin for peripherals, do.
Yeah. So that is my understanding. What we are actually seeing is there are a few things that help remyelination. Basic lifestyle stuff, move, exercise, eat well, drink enough water, drink clean, purified water.
I'm sure stress management.
But some of the things coming out, there's like a lot of research on semaglutide or Ozempic for
remyelination.
Yes.
Oh, which is a bummer because it's like, I feel like it's so used.
Yeah. But the flip side is like, this is not
the miracle drug. It helps with myelation.
Yeah.
It helps with muscle. Well, I heard there's another one they're coming out with that pairs with semaglutide for muscle maintenance and growth while being on Ozempic or semaglutide for fat loss.
Yeah, there are a lot of really good stacks that mitigate the problems with Ozempic. Semaglutide, the main problem with it is the dosing and the lack of lifestyle education surrounding it. So like, we use GLP-1s in practice.
I mean, it sounds like it's super helpful. I mean, imagine somebody who's like obese and they like, I've done everything I can. They have no momentum, no encouragement.
Yeah.
This helps get the things running.
Yeah.
And they're like, oh, I'm losing some weight. And it just only, reinforces and encourages more active steps.
But like the way we do it, like, first of all, the majority of our patients are on microdoses. And they don't even want weight loss. They want the brain benefits, the anti-inflammatory benefits, the sleep benefits. They want,
and that's what semaglutide can bring.
Yeah. So at a microdose. So before you even get to any appetite suppression at a microdose, you can actually get all these anti-inflammatory benefits from it. And the patients that do want the weight loss, like Doc's approach to it is low and slow. So like, I don't think we've ever had a patient that hit the top dose ever.
And to the point that they didn't need it.
Yeah. So like the standard dosing protocol is basically, you start at the intro dose and you double it every 4 weeks until you hit the top dose, give or take. It's pretty close to that. And Doc will keep someone on the intro dose as long as they're having their goals that they're hitting. So like if you're losing a pound a week and you're on the intro dose, you don't need to go up.
Then why go up? Yeah.
There's no point.
Other than just impatience.
Yeah. And the problem is you get impatient, you start losing 3 pounds a week. What are you losing now?
Yeah. Muscle included. And maybe other things too, like that's not
stuff.
Yeah. So I would imagine it's still a conversation with patients. Be like, imagine like it's low and slow. And this is still a year journey where it's like, if it's June right now, imagine like, June of next year, Father's Day of 2027. That's when we're going to look at what differences we have at this point versus like, in a month, you're going to be like ripped and like 5% body fat.
Yeah. You got to set up the expectations. And the cool thing too about going low and slow is the symptoms are mitigated. So like you get the GI distress, you get the diarrhea, the constipation, whatever might happen if you're going too high a dose too quickly, and you're eating crap.
And you don't change the lifestyle with it. Yeah.
If you change your lifestyle and you eat clean and you go on a low dose below the intro dose of what like Ozempic is sold at, and you step up super slowly, almost no one has the side effects.
Amazing.
Yeah.
It's cool.
Which you just got to navigate, right?
So let's say somebody comes in and they do want weight loss and they feel foggy, they don't feel great, right? What's the expectation time frame that you educate people? Like, hey, we're going to do a super low dose on this, below the intro, typically for semaglutide. What's the time frame?
It really depends on how much they're looking to lose. So like we aim for a pound a week. So if you're trying to lose 10 pounds, 10 weeks.
Yeah.
If you have to lose 100 pounds, we usually go pretty fast, like a lot faster in the front end, because you naturally will lose weight when you have that much weight to lose a lot quicker. So you'll be at that 2 or 3 pound mark per week for the first month or two.
So it starts out quick and then tapers down. Versus like start low and then you'll exponentially lose more.
Yes.
Interesting.
So we actually want you to, so like if you're significantly overweight, you'll see the weight drop fast. And then we actually want you to settle around the 1 pound per week.
Yeah.
Because when you start it, you're losing water weight, you're losing inflammation, and you're not losing 3, 4, 5 pounds of fat.
Of adipose tissue.
Yeah, 5 or 6 pounds of fat a week is actually like usually physiologically impossible to lose.
Yeah.
Because you're not burning enough calories. You'd have to eat nothing. And then can you even oxidize that much of the lipids? Like your body can't even process that. So that 5, 6 pound fat loss that they might have on the front end is mostly just water.
Yeah. I got you. Next would be chronic Lyme. So what do you guys do for that?
Yeah, we have a Lyme protocol.
Because that's another one that's shunned by the medical field,
Yeah, you just take doxycycline and that should fix it, right? If you have chronic Lyme, doxycycline is most likely not going to fix it. Now, if you get bit and you see the tick and you rip it off or whatever, go get the doxycycline. Like go right there.
Yeah.
Because actually, if you get bit and you get the doxycycline before the rash appears, you have a really good chance of stopping it. It's done. Even post, like once the rash appears, I think it's around 40 or 50% is what we've seen. If you get the doxycycline, like while the rash is active, you get about a 40 or 50% chance of that just knocking it out.
If someone gets bit by a tick, is it like you will get Lyme? What's the percentage on that?
Not necessarily. I don't really know the percentage off the top of my head.
Like I got bit, and I saw it, and I didn't get Lyme. No, that didn't happen to me. I'm saying,
yeah.
Does that happen?
Yeah. No, that happens fairly frequently. Like we actually just had a patient, I think it was last week, who was always concerned about Lyme because she's been bit by a bunch of ticks, and she was negative.
Huh.
And then the flip side was,
how does she know? I mean, they're tiny, right?
Yeah. I mean, you could see it. And then unfortunately, after an entire life and many, many tick bites that she didn't get Lyme, she got bit by one that did have Lyme, and she got it.
What's she doing? She hiking in Asia? Like
it was literally just like walking around outside and hiking.
Here?
Oh, here it's in Florida. It's in the Northeast a lot. It is exploding. So like you can read the news reports. Like confirmed tick bite cases are just exponentially rising right now.
Really?
Mm-hmm.
Is that? I've heard some conspiracies on that, but is that just because of like diagnosis awareness?
I don't necessarily think
like
so. Spectrum
disorders are skyrocketing.
Mm-hmm.
It's like, well, have they always been there? We're just now diagnosing them.
Yeah, I don't necessarily know if I agree with that either, but
oh, okay, interesting.
No, I honestly think because diagnosing Lyme, like acute, like Lyme because you got bit, is not very difficult. I really don't think it's the diagnosis. I think it literally is the tick population.
It's rising.
Yes.
From how?
I don't know. I'd have to learn ecology, honestly.
I was gonna say I'm not an ecology guy.
Yeah.
I did not do well in ecology. I did not take. Yeah, that's not my thing. It's just not my thing. Or zoology. That's what I was gonna say. So what would be like and then Epstein-Barr. So that's the mono, right?
Yeah, mono. So like most people in their life will contract mono. And for most people, it's really not a big deal. Like you get sick, you don't feel well, it's a few weeks, move on in life. What happens is when the immune system is suppressed, this virus can actually reactivate. That's when you get all these chronic effects from it. And getting that back suppressed, getting that virus back under control is a big game changer for people. So like we see CRP elevated and we can drop that CRP.
What's CRP?
C-reactive protein.
Okay.
So it's like an inflammatory marker. Traditionally, it's used as a heart marker, but really it's a total measure of inflammation. So getting that virus back under control is a big thing.
What's the best stack? Let's say somebody comes in and they are concerned about parasites. You did testing, they have mold harboring and some medium heavy metal dysfunction.
Mm-hmm.
What do you do?
Yeah.
It's like, hey, you want the best protocol.
Yeah. So the best really is attacking each toxin with what it needs to be treated with. So, for example, like mold and heavy metals. So if you have mold and you have heavy metals, attack the heavy metals first. So chelate, get them removed. And the reason I say that, it's pretty well established that the mold lives in biofilms. It's kind of stuck in the body in these like little protective biofilms. And the bones, the foundation of those biofilms is heavy metals. And so if you pull the heavy metals out,
The mold will.
80% of patients who have mold symptoms that have heavy metals, the mold will just go away.
Wow. So it's a heavy metal problem.
Yeah, so it's a heavy metal problem. So, and we usually give something like a prescription to kill the mold as well, because
What's that?
might as well. Itraconazole.
Okay.
So it's an antifungal.
Oh, okay.
Yeah,
Is that a pill or IV?
yeah, pill.
And the mold harboring that, I mean, are people living in their homes with just excessive mold?
Yeah. So most of the time it's the home, especially being like here in Florida with the humidity. Mold can grow in ambient humidity north of 50%.
Wow.
So like having a whole home dehumidifier can mitigate that.
Yeah.
Leaky windows, leaky showers, you name it. If you're not,
Is there a way to test the ambient mold? What's the best way to test for mold in your living area or your workspace?
Yeah, best way to test is highly contested. I like using a professional company. This is not something I would DIY, because like you can DIY some air samples. It's not a very good way to test because like it only shows you what's actively moving in the environment. So, but what if your dog runs through and its tail swipes some stuff into the air? Like that's going to change the sample drastically.
Yeah, it's true.
And so usually when you're doing air samples, nothing's moving in the house and you're just testing the air right there.
Yeah.
So like I like a combination of like air samples, thermal imaging for water spots, visual inspection for any water damage. You could get a mold dog. So they sniff mold and they'll call it out when it is.
So let's say you find some and they're like, hey, we're treating your mold, your heavy metal is cool. But you're living in a mold infested area that you didn't even realize. What do you do? Like, what do you suggest?
Yeah, so we don't go into the whole remediation thing because it's not our wheelhouse. I mean, personally, I can because I have a background in construction. Like that's where I started. But for our clinicians, they're clinicians. They're not contractors. So we work with a company here. It's called Holmes. You should actually intro you. You'd probably like to meet them. Yeah. But they will do comprehensive testing of the whole house. So they'll look at your water quality. They'll look at your air.
What are they called?
Holmes. HOMEYS. Like chilling with my homies.
Yeah.
So they'll do like comprehensive air quality testing, water testing, visual inspection, thermal camera. They'll look at your air handler and they'll give you like a really comprehensive report of everything that needs to be fixed. They will fix some of it if you want them to. And for the big stuff like the remediation, they have like the top companies that they've qualified that can help remediate.
So they're a diagnostic.
Yep.
And then they'll be like, you need to fix this, and this, call this company to fix the thing.
Yes, which I appreciate because they're not going there to sell you renovations.
Like they have their one thing.
Yes. They're going there.
There's no incentive to be like, you have 15 things wrong, pay us. Like a car mechanic. Like, this thing.
Yeah. So they go there, they say, hey, this is what's wrong. We recommend fixing 1, 3, and 5, number 2. Get it fixed in the next like 3 years.
Yeah. So the authenticity of their suggestions, there's no incentive that are going to benefit to like, elevate. Okay. That's good to know. All right. So testing, a treatment for mold and heavy metals, you would do the heavy metal chelation first, then the mold detox med. And then what?
And I would stack EBU on that as well.
And then EBU.
Yeah. So it not only will pull mold out, but it'll also clean up the entire system. And so,
and how many treatments of EBU does that take? Usually
gold standard's 3.
Oh, okay.
It's not crazy.
We had somebody that came in that they did the EBU and they were like, oh, my blood was like dark. And then after a couple of treatments, it got better color. Yeah. Like the stuff that was removed was dark. And then there's like less toxins that were pulled out.
Yeah.
How often do people need that then? Like every 10 years, every 5 years?
So, we tell most patients, like you do your initial set of 3, come back for a touch up, maybe once every 6 months or once every year.
Just for one treatment?
Just one treatment.
Oh, okay.
Yeah. It's not something that like I'd recommend. Like, so if you're dealing with something really deep and we've got like massive toxin problems and like we've got a lot of work to do, maybe you're doing 10 of them.
Yeah.
Like you might need a lot more.
Yeah.
But for the most people, like 3 is kind of the gold standard. And then just a maintenance like every 6 months or once a year.
Yeah.
Just come back and do one. Because, you know, you get exposed to stuff.
Right. Interesting. Okay. And then parasites, is there a pill you take and then it like,
so
you rid that?
This is one of those things that Doc just like loves to rant about. Because in the functional and integrative space, like ivermectin is like the thing, right?
It's got a lot of attention.
Yeah. Like it'll cure your anything. And ivermectin hits about a third of the parasites. So like if you treat a horse for parasites, they give what they call triple therapy, right? You give 3 separate antiparasitics that hit roughly a third of the parasites each. And so we take that similar approach. So we use actual pharma, but like we use 3 specific medications and we do a global parasite cleanse. So we hit it from all angles.
Cool.
And we do shorter, like not crazy intense bursts because parasites live in the life cycle. So they might be an egg or larva or active. And so we would like to run a shorter course that will kill the active ones. And then we can rerun as needed, not just like an extended brutal parasite cleanse that you're just like high dosing for a long period of time.
Ebu for that as well, you'd recommend? Yeah. I mean, we recommend Ebu for everybody pretty much.
Ebu, the beauty of Ebu is like, it's not going to do you wrong.
There's no negative.
Yeah. You're cleaning the system and you're super oxygenating. Like at the end of the day,
it's amazing.
Yeah. And how it works with the modulation of the immune system too. It's a modulator. So like if your immune system's underactive, it'll bump it up. If it's overactive, it'll bump it down.
It's cool. Yeah. That's awesome. So how do people usually feel? Like heavy metal treatment, mold, parasite treatment, some 3 Ebu treatments after, I don't know, 3 months, 2 months.
Yeah. 2-3 months. Most people are feeling a lot better.
What do they report?
So I think the number one is sleep, better sleep. Oh my goodness. I can actually rest. A lot of improvement in mental health symptoms. You see that a lot.
Like emotional volatility or fog?
Both. And even like anxiety. So even more extreme ones.
Yeah.
And then we see like the cognitive piece of it is huge. Like, oh my goodness, like my brain's back on. Like I can think, especially with Lyme. Like we had a guy the other day. He did a Lyme protocol with us and he was talking to me. He was like, dude, I've been dealing with this for like almost 30 years. And like, I couldn't read a book and now I can read. He's like, I can actually read again.
And like absorb.
Yeah. But he's like literally like his brain was to the point where he like physically could not read the words on the page.
It's crazy.
Yeah. And he's like, and now I'm reading books.
That's awesome.
Yeah.
That's really cool. Well, let's get into the stem cell stuff. So how have things, where are we at now? Like when somebody comes in, I would imagine joint issues would be the number one thing people want stem cells first. What do you do?
Yeah, so we have 2 kind of stem cell camps, if you will. It's the joint and musculoskeletal problems, and then there's the kind of like systemic autoimmunity and longevity. So for like joints, tendons, ligaments, the whole deal, we actually use what's called a tissue graft, a placental tissue allograft. And it's actually the raw materials that your body needs to rebuild that structure. And so this differs a lot from most people's stem cell injections, because you go into most stem cell clinics and say you have a knee problem, they'll inject stem cells right into the knee. The problem with that is you gave the signal, now you're relying on your body to source the materials and rebuild. Stem cells do not differentiate into the cartilage. People think they do. They do not. They're signaling cells. They signal the body to go do the work. But if you instead of stem cells, you actually put in the tissue with all the raw materials, with the inflammation signaling and everything it needs to regrow,
Then it has the actual building blocks to do it.
Then it has the actual building materials. Yeah. And that's how our approach differs.
So you're injecting like the stem cells with cartilage material?
Not necessarily cartilage material. So it's actually like, it's a mix. It's placenta tissue. It's like tissue from the placenta.
Oh, yeah.
But the growth factors in there are the things that the body needs to differentiate into cartilage. It basically is fuel for the chondrocytes, which is the cartilage cells.
Yeah. Cool. And have you guys, are there any like tests like pre and post MRI?
Yeah. We have plenty of them. We had one guy with, this is a great example. We had one guy who did knee injections, and 4 days later, he decided he was going to hike a mountain. And we were like,
not yet.
What are you doing?
Yeah.
And he was like, my knees are hurting. We're like, well, yeah, you just had them injected a couple days ago. Like, you're supposed to take at least 2 weeks of downtime and not intense exercise. Like, give it a break, like 10 days, then go to PT. Like that's how it works. But he was like, I don't know, did I ruin the stem cells? And we were like, no, you didn't ruin the stem cells. Like, just don't worry about it. He did his 1 year MRI, and the cartilage was fully rebuilt.
Oh my gosh.
Yep. Even after he went and hiked a mountain 4 days after the treatment.
Wow.
I mean, it hurt him. Like, he was in a lot of pain.
Yeah,
but
like, sensitivity to the injection.
Yeah, but physically it didn't change the outcome.
Wow, that's amazing.
Yeah.
I would imagine like lumbar, spinal, cervical spine, like vertebrae regeneration.
I actually have my MRIs for my lumbar spine. And where I was 4 years ago, I've tripled my disc space in my L5S1.
Oh my gosh. That's cool.
I was a full herniation directly out the back. So usually a herniation will slide on one side or the other. Mine was like fully in the middle. And I went to a top neurosurgeon. They were like, I don't ever see this. They're like, I see maybe like 1 in 500 of these.
Wow.
And she's like, if you were older, I'd take you in for surgery right now. And I was like, oh my gosh. And then since then, with stem cell procedures, I have gotten most of my disc space back, and the daily limiting life factor is gone.
Wow, that's amazing.
Like, my back will ache a little bit if I drive for hours.
Yeah.
But whatever.
That's awesome. What about your shoulder?
Shoulder. I actually did a few rounds of stem cells in the shoulder. Unfortunately, I was part of our testing group. So I'm always like, doc is like patient 0. I'm like patient 1, right? So I test new products. And about 2 or 3 of the things we tested didn't work very well. And honestly, it was I think it was the combination of the PRP I did. Because I actually did a PRP that we knew worked.
Do you even do PRP anymore? Oh, okay. All right.
Yeah, we do PRP. So I did PRP, and then I actually did the exercises that you showed me.
Yeah.
And it's working.
Amazing.
Like, it has not.
Yeah, you look more muscular. I mean, you've been working out.
We put some muscle on.
Yeah. Good. That's awesome. That's super interesting. So like, what's the mechanism? Like, so you're injecting placental tissue with the stem cell,
with live stem cells,
with live stem cells, and those are donated from 18-year-old humans. Like what?
They're young females, so they're adipose derived.
Okay.
So it actually comes from fat. So young, healthy females that pass all the screening. Their only health problem is they're overweight.
Okay.
And so they go in for liposuction.
And then use that.
Yep. And the reason we use that, because there's a lot of talk about umbilical, right?
Yeah.
The reason we use that is if you look at the growth factor breakdown of adipose cells versus umbilical cells, and you can even ask like ChatGPT this, like the growth factors in adipose cells are highly favorable for joint regeneration. Like it gives you even more raw materials for chondrocytes for that cartilage
than umbilical would.
Yep.
Interesting. And the compound pharmacy that you guys use, how do they screen these people?
Yeah. So it's pretty extensive screening. It's blood work, it's testing, it's all the FDA screening as well. The FDA is like the minimum, right? That's like the floor, and then we go above.
Yeah.
They also fill out surveys, and you have to meet like all the criteria in order to get through.
Wow, cool.
And they have very stringent sterility and processing requirements. So much so that like they've had batches that they just
will toss.
Yeah, they're just like, didn't make it.
Yeah.
There's like $250,000 of stem cells we have to throw away.
Oh, that's a bummer.
Yeah.
That's a bummer. I remember you were mentioning like, because other countries, right? It was like here, and still talking to people. It's like, oh yeah, I got to go to Germany or Panama, Costa Rica to get stem cells. Maybe you were describing before that like there's a turnover growth of this actual stem cells before they're injected, and if they go over a 3-time turnover, then like the effectiveness is decreased.
Yeah, that one's hotly debated. So, not the turnover is hotly debated; it's the number of expansion cycles. So, somewhere between 4 and 7 is like the cap. If you go to like 8, 10, 12, that's when you're increasing the risk. It's called mutagenic risk.
Okay.
So, what are these things turning into? What is the signaling going to do?
Yeah.
Because we're just making it expand. It's basically like a stem cell foie gras. They're force feeding the goose. They're force feeding the stem cell to continue to replicate. And if you go to like Mexico, Panama, some of these places are doing 10, 20, 30 expansions.
Wow.
And like personally, I would not put anything over 8, I would not put in my body.
And where are you guys at?
We're actually unexpanded.
Wow.
None.
That's amazing. So it's a quick turnover.
Mm-hmm.
No pun intended. Like it's a quick receive and inject.
Yep. So
that's awesome.
There are no expansions.
Wow, that's amazing. So it's literally the purest, most advantageous for musculoskeletal.
Yeah.
And this is the 3rd generation of development of stem cell applications.
So we actually,
and each generation's improved.
Yeah. So it's the 3rd generation of the placental tissue allograft. The way we combo them, I'm not sure if there's anybody else doing what we do. We might be the only ones.
It's amazing. What's next?
Next is
teaser
Gen 4. There's 2 things I want to highlight that are next but we're always iterating on our stem cell products, because we believe there's always like new science is coming out. We can always get a little better.
Yeah.
Our results are absolutely remarkable right now, but next is a product that we're iterating on, and it's basically going to be enhanced growth factors and a little bit more power.
For musculoskeletal?
Yeah, for musculoskeletal. It's not like, I wouldn't say necessarily yet, because it's in development. It's going to be a game changer. It's an incremental improvement. There are some things that we're working on in the background that could potentially be a game changer.
Cool. That's awesome. And then so if somebody has, knee OA, back pain, whatever, what would be the best protocol for that?
Yeah. So
like testing for mold, heavy metals, the EBU stuff, like that, blood work stuff.
Yeah.
Would be part of it.
Yeah.
And then stem cell injections.
Yeah. So, I mean, I recommend like, stem cell injections have a healing arc, right? So like if you want to get the healing going, you can start with those. Because of the lack of blood flow in those areas, for the most part, detox is not really going to negatively affect the stem cell injections. If you wanted to do it as like clean and pure as possible, like you would detox and then you would do the injections. But rarely do we ever see that it ever causes any
huge major benefit.
Yeah.
Gotcha. Really cool. And then stem cells also systemically for rheumatoid arthritis, which is an inflammatory it's an autoimmune.
Yeah.
So EBU would help with that, I imagine.
Yep. Very much so.
And systemic stem cells through an IV.
So stem cells work a couple of different ways systemically. So they work as signaling cells. So they'll find inflammation and they'll signal the body to go fix that. They also work through paracrine signaling. And so they will modulate the immune system to work more effectively.
Yeah. Either raise or lower.
Yep.
Yeah.
And so some of these autoimmune conditions, it's not like a one and done, right? You're not going to get a stem cell injection and be like, I'm healed. Like you're probably going to have to do some rounds, and it's going to be some incremental improvement as we go.
For the IV stem cells.
For the IV stem cells.
How many and how spaced out?
It really depends on the condition, the severity, and that kind of stuff. The flip side is like if you're using it for optimization and longevity, you're probably like, you're going to feel it on one. You're going to feel the benefits, especially like brain cognitive function. So like we do the intranasal injections. So we'll go like right in the back of the nose and inject on both sides, and it rides the nerve up into the brain. And for TBI, for cognitive decline, brain fog, stuff like that, it's pretty pretty impressive.
Wow, that's cool.
We had a kid who came in and did the intranasal injections, and he had bad TBI, like really bad, like to the point where his like personality was kind of gone.
Wow, what happened?
Hockey.
He's got a concussion.
Yep.
Wow.
Yeah. And he did the intranasals stacked with IV, and his personality started coming back to us like while he was in the chair before he left the office.
Wow. How old was he?
I think he was like 18, 17.
Wow.
Yeah.
That's amazing.
Mm-hmm.
And how have you heard from him since?
Yeah.
Does he come back for another round, or were you? It was like that was good.
I think he came back for a couple more rounds, but I believe he's in college now. I think his mother and his principal will agree the only reason he graduated high school was those treatments.
Wow.
And so now he's in college and doing well.
Thriving.
Yeah.
Amazing. So a stack of systemic IV stem cells, and that will also heat seek missile, like target the pancreas, or like right for like type 2 diabetes or type 1 diabetes, maybe for like if they're a type 1 issue, liver, kidney, heart, all that stuff.
So the organ-based treatments is where you want to do the IVs.
Yeah.
And
then immune.
Yeah, and immune.
So the EBU really helps with immune regulation.
Yep.
And stem cell.
Mm-hmm.
So for autoimmune issues like MS, RA, that's going to be super helpful.
Yeah. So we always recommend the EBU before stem cells. Cleans the system up, helps the immune system, primes it. So even injections, like joint injections, stuff like that, we recommend you do an EBU because it's best practice. Let's just get you super oxygenated. That's going to help your healing. It's
going to be much more receptive to the next injection. What other autoimmune issues can that help with? RA, MS.
Yeah, we see a lot of like Hashimoto's, thyroid.
Yeah, thyroid.
Yeah, so like we can do a direct injection of the thyroid with stem cells. And originally it was pioneered with PRP, which showed pretty cool results in getting the antibodies down.
Yeah.
And stem cells just last longer than the PRP does. But yeah, like Hashimoto's.
Well, stem cells are just superior to PRP.
It just is in just about every way.
I mean, when patients ask, my answer has been, don't even do PRP. If you're going to just do the stem cells, If
you can afford it, do the stem cells.
Yeah.
They're drastically more expensive than PRP. And PRP hurts more. It does. Yeah. It hurts more. And then, it also no one's ever really, I don't want to say no one, very few people fix their musculoskeletal issues with one round of PRP. You usually need like 3 to 5.
Yeah. I don't really see, but again, people come to see us because they're still having an issue, but, I don't know. It's just not something that I would do.
Yeah.
Personally.
We have it. We offer it, to be honest with you. Most of our patients opt for the stem cells because it's like, most of them don't want to get stabbed more than one time.
Yeah. Like just do this once.
Yeah.
What about, spinal cord injury for stem cells?
Yeah. So, this is slightly outside my wheelhouse, but I believe Doc does like cannula epidurals for stem cells, and he'll also do
will that help regenerate like a spinal cord?
It's getting into the theoretical.
Okay.
Practically, we've seen great results on it. So it's kind of an area where we need more data.
Yeah.
To be honest with you, and I'll always flag when we just need more.
Yeah.
Also getting Doc's opinion on the individual case, because there are nuances to everything. It's
of course.
So you might have instability in these lumbar ligaments, and you might have instability here, but you also have this disc issue. And so if we treat these, maybe it'll give us the space for the spinal cord to actually regenerate and function like how it needs to.
And what about stroke?
Stroke, yeah. So we do, you think about what is a stroke? Loss of
blood flow to the brain tissue.
Essentially oxygen.
Yeah.
So EBU, it's a great one. We're going to super oxygenate the body. And then, stem cells can help potentially. We do the intranasals, potentially help regenerate some of the brain function.
Have you had anybody come in? It's I had a stroke 10 years ago and they have a droopy face, weakness on one arm.
Yeah. Yeah. So we see people who historically have strokes, and they usually will do either the IV stem cells or the intranasal stem cells based on.
And do they regain function?
It's sometimes hit or miss. Like, I wouldn't say that like regaining function would be a win. I would say measurable improvement. Like,
Okay.
hey, my speech is better, my face is better, my arm is better. I wouldn't say it's like the next day I'm going weightlifting.
Yeah, playing basketball or something.
Yeah. Okay. It's just not that dramatic.
I'd be curious, like if, within a 24-hour period of a stroke event, they've stabilized, right? And then they're in the hospital, stem cell injections.
Honestly,
I wonder what would happen with that. Because I know there's a lot of neuroplasticity super early like that,
I'd actually love to see some data on that and someone study it, or because I don't think we've had that. I don't think we've had a patient that's been that recent.
Well, it's super rare. I mean, well, that's not the first thing that people,
They're not like, I had a stroke, I need IV stem cells.
Yeah. They don't even know.
Yeah.
And stem cells aren't even a thing. They don't. It's not knowledgeable in the community anyway. Which it sucks. I'm like, why not just like full send on federal benefit grants, to like study and research this stuff.
Yeah. I mean, that's what I would do. Like, if I had a stroke, I would be, as soon as I got out of the hospital, I'd be doing this stem cells.
Yeah, same. For sure. Spinal cord injury, same thing.
Yeah.
TBI, same thing. Yeah, it's a bummer. What about like Parkinson's, Huntington's disease?
Yeah. So we'll do the intranasals for that as well. Fortunately, it's kind of like a 50%.
It's noticing a measurable improvement of some sort.
Yeah. So it's kind of a coin toss. It works with some people. It doesn't work with others.
Interesting.
It's one of those things that, like, to be fair, that percentage is still vastly better than most other things. Yeah.
I wonder if there's science fiction world where like a neurosurgeon could put a syringe in the necrotic tissue or the substantia nigra, right? Brain ganglia, basal ganglia for Parkinson's, and like inject stem cells and bathe it in stem cells.
Maybe. I don't know. That's probably above our capabilities, but
that'd be super interesting. Like would that, what would happen? Cool, man. It's awesome. Last thing. What do you not do? The genetics?
Yeah, we don't
genome.
Yeah, there's a lot of stuff that like really serious genetic based conditions that we just don't have a great answer for. So like, the screenings that babies go through before they're born, they do the amniotic tissue sampling and they screen for the
trisomy. Yeah, and other genetic abnormalities.
Yeah, so stuff like that.
Cystic fibrosis.
Yeah, so we don't really, the big like genetic variation diseases we don't really get into too much, and I want to say specifically the ones we know are genetics, not like genetics plays a component or could play a component, or the research tends to lean towards genetic, but like, hey, here's this genetic abnormality that you have, this mutation, and it's probably terminal. Like, we don't have great answers for that. There are some really cool technologies coming out, like CRISPR. You can actually snip part of the genome and put a piece in, like with different coding, and potentially delete the genetic abnormality. We're probably 10 years out from seeing some of that research on.
That's crazy.
On like terminal patients.
Yeah.
It's a little scary. Yeah. Like the applications, and like that gets in the wrong hands. And then what are people doing to mutate themselves? And then like, we also don't know everything that happens when you take out a part of the genome and substitute it with something else.
Yeah.
Like
changes your personality, like volatility, who knows?
Yeah.
Or I wonder if they're like the same kind of thought, but like an embryo, or like an egg and a sperm, and then mutate those specific genes before they even meet. And then,
like I want blue eyes. I want like
6'10", 350 pounds, more density of type 2 muscle fibers, more predisposition to have no body fat percentage,
It seems like science fiction, but to be honest with you, we're like not terribly far
away from that,
which is scary, because like that's more of like an ethical debate.
Yeah,
like,
I know.
Where do we draw the line?
Where does it end
on what it is our right as humans to be able to manipulate, and what we should leave to higher powers.
Yeah, exactly. or just like the genetic predisposition to have mental cognitive superiority, just like super smart, I don't know, quick, all that stuff. It turns into like the Superman, like Kal-El. What's their planet? I forget the name of the planet, but they all had farming, babies. I mean, like this batch of babies are going to be farm workers, and this batch of babies are going to be, laborers and stuff like that. Like, yeah, it's a bump. It'd be crazy.
It would be crazy. So there's a lot of really deep, like, ethical arguments that need to be had with that. Right now, the science is really early days, like mouse models and stuff like that.
Hopefully 20, 30, 50 years, Well, thank you for coming in. Super interesting conversations. And, we're always chatting with patients and stuff about how y'all can help, So I appreciate you coming in. If people want to reach out, how can they find you guys?
Yeah, you can go to our website, thelcfl.com.
The LCFL.
Yeah.
The Longevity Center, Florida.
Yep. If you're in West Palm, that's where to go. If you're not in West Palm, you can go to the LCOA, Longevity Centers of America.
Oh, of America.
Yeah, we have a second website. But really what I tell people in podcasts is just go to our podcast, Longevity Unlocked. Check us out there.
Longevity Unlocked.
Yeah. We lose a bunch of money every month putting on this podcast. It's really just for education.
Yeah, I mean,
there's no sponsors.
It's the same thing.
Yeah. Yeah.
It's just fun and it's cool and engaging conversations,
Yeah.
And then helpful information, Yeah. Well, if y'all have any questions, comments, concerns, don't hesitate to reach out. We'd love to chat. And at least, if you have any musculoskeletal things that you feel like we can help with, we'd love to chat on the phone and at least give you some guidance and direction on what to do next. And we'll catch y'all next time.